Hi, I'm Joseph Patton, Clinical Risk Coordinator. During February here at Cooperative Health, we celebrate Black History Month. During a time when efforts to achieve social justice and racial equity are at the forefront, it is important to pay homage to African American pioneers who made immense contributions to society. We all know the stories of icons like Martin Luther King Jr., Rosa Parks, President Barack Obama, and Shirley Chisholm, to name a few. During this month, we will be sharing stories of significant African Americans you might not know during Black History Month. Look for their stories in a weekly connection, Cooperative Health, social media, and Cooperative TV here to come in a few weeks. So as a reminder, Black history is American history. And here at Cooperative Health, we celebrate diverse stories in our community.
My name is Dr. Aprel Barnes. I work primarily at Brooklyn Community Pediatrics in West Columbia on 12th Street. I am currently the Pediatric Division Director, but I still see patients in the clinic most days of the week. So my parents grew up in rural South Carolina, and when they grew up, healthcare wasn't very accessible for them, and that was something that they instilled in me, that healthcare was very important. So I grew up in Columbia, and Dr. Clarence Dollison was my pediatrician. And so from the beginning, I knew that healthcare was important, but I also had a role model showing me that I could be a physician as well. So my mom worked for a local civil rights organization, and I saw inequalities firsthand, as well as people working together to improve those inequalities. And so when I was looking for a career, I was looking for something that would allow me to work on inequalities, teach, uplift my community. And so I shadowed a physician my junior year at Spelman College, and I saw that she did all of those things. She taught, she educated, she worked with her community, and so from there I knew that being a physician is what I wanted to do, and the rest is history. So I feel like most of my training up to this point has been preparing me to work at Cooperative Health. So when I was at Spelman College, I did a fellowship during the summer on health disparities, and part of that was going into the community, providing food and HIV testing and things like that, and learning how policy impacts the healthcare of the community. When I was in medical school, I was a part of a special program, or selected for a special program, where we were partnered with a patient to help them navigate the healthcare system and help to kind of advocate for their care. And then once I was in residency, I did a mission trip in Zambia where, I provided with the team primary care to children who rarely got that. And so I feel like Cooperative Health's mission of being the Good Samaritan really brings everything full circle for me in terms of allowing me to utilize the things that I have learned thus far in order to care for my community and advocate for my patients. Before I even knew about women in medicine, I knew about women that were impacting their community through advocacy in different forms. So that, includes my mom, that includes Majeska Simpkins here in Columbia, that includes Miss Eliza Briggs, who wanted to make sure that children in the Black community had an equitable education. So from there, building on top of that, in medicine, women like Dr. Rebecca Crumpler, who is the first African-American female to be licensed as a physician in the United States, Dr. Matilda, who was the first African-American female to be a physician licensed in South Carolina, whose home is still on Taylor Street. And then our own Dr. Stewart, who in 2020 became the first African-American female to lead the American Academy of Family Physicians. So all of those women, I stand on their shoulders in order to do the work that I do, and women in medicine is so important. This is longer than a decade ago, but a lot of the strides of women in healthcare came with the passage of Title IX in 1972, where it stated that schools that got federal funding could not discriminate based on gender. And so from there, we see that a lot more women were enrolling in medical school and graduating from medical school and becoming a part of the workforce. So, in addition to that, there have been a lot of women in healthcare being more so in leadership, so surgeon generals and CEOs, division directors like myself. And so with women coming into medicine, into the 1970s, and even before then, now we're seeing those women take over and do more leadership positions. So there's a poem that talks about the hand that rocks the cradle rules the world. And I think that women carry so many things and wear so many hats. And so they can be a little bit more flexible in terms of what's necessary for patients and their care and their advocacy. You have to tailor your treatment, you have to tailor your education, you have to tailor your services to the patients themselves. And I feel like women who have so much to juggle are a little bit more flexible in being able to navigate all those things. So I feel like part of what's happening is that the ideas about women have changed as our society has changed. And so no longer are women needing to be more docile or have a certain type of modesty. And the ideas that women are not as smart as men are not as overt. And there are policies that support women going into different fields where previously they probably were not able to. In addition to that, I feel that basically women now are taking advantage of the opportunities that the women before them did not have. And so we are seeing that now that the barriers for women going into medicine have been lowered and there is policy that makes that possible, we are just seeing the fruit of women who maybe generations ago wanted to be physicians, their granddaughters, their daughters finally being able to do that. And so, yes, I feel like women are the future of healthcare, but because the future of healthcare needs to look like the patients. It needs to look like the US population. And so women make up 50% of the US population, but only a third of the physician workforce. And so my hope for the future is that it's not just women, that the future be African Americans and other ethnic groups, that it be LGBT, but basically that the future of healthcare be that it is reflective of our US population.